Okay, China's population is aging. I think that much has been talked in China. This is assumption used by UN population prospects for China's population. In 2010, the projection was made in 2010. Newer version was available, but I believe not improved. There's no improvement, so this still may be better. The three variants used: high variant 2.5 children per woman, medium variant about 2.01, and 1.5 low variant. And they gave the projections like the total population size by the end of the century, just over 500 million, and then over 941 million about, and this is high variant. And the number of working age population, the low variant will be very low. And the elderly population, 65 and older, over 350 million after the middle of the century. Then the three variants would differ only after, because we cannot affect the elderly number of elderly population today. But look at the proportion of elderly population. I think this is high variant. Over 20%, and the medium variant around 30% for several decades after the middle of this century. And this is a low variant, very high proportion of elderly, over 40%. I think the real challenge is population aging will result in epidemiologic transition. That means that the dominance of non-communicable disease. And this is quite serious in China, because according to a survey conducted by Dr. Ning Guang at the Ruijin Hospital, it's published on Science or something, that the morbidity of diabetes in China is already 11.6%. And 70% of the patients were not aware of their morbidity. This is even higher than the USA, a little bit higher. I think that this is only a representative case that NCDs are becoming a serious problem in China. The changing lifestyle and the high calorie intake and the lack of physical exercise, and the smoking and the environment, pollution, something, all contribute to the high morbidity of NCDs. So I think a very important thing is how to promote preventive care for under the population aging in a new situation. But I think the current, I think let's do this. There are many defects in the Chinese healthcare system, which are not promoting, but rather making problems in the people's health. I think one big problem is price distortion, and the profit-seeking behavior of providers. There's a long-time practice of overpricing of drugs and high-tech checkups, and the underpricing of labor services of the medical workers. So that need to lead to malpractice of hospitals. They have to, and the hospitals have to drive most of their revenues from services, from drug sales, high-tech checkups. There's a serious problem of over-prescription of drugs, high-tech checkups, and other profitable services. So the current system is favored the services biased toward more expensive curative care and at the price of preventive care. In China, even there's a tension between the providers, physicians, and the patients. Many reports on the news medium, I think. The other problem is, I think, for the primary, secondary, tertiary, three-tier hospitals, because it's not profitable to provide preventive care. So even the primary healthcare institutes are try to do some curative care to generate revenues. But for the nation as a whole, we can see preventive care is, preventive interventions are more important, more efficient for facing the challenge of population aging. So I think that one of the focus of the future reform should be to give higher priority to preventive care. I think in terms of economic analysis, the primary care has more nature of public goods, very goods, and the more externalities compared to the tertiary care. So I think based on the above analysis, I think for the future reform, we suggest that the government should play a more important role in the financing of the primary and the secondary care providers. The government should motivate the providers, the primary and secondary care providers, to be more engaged in preventive care. How to do this? I think one way to do this is for the primary and secondary care, we should implement contracted services. That is, to ask the residents to choose one primary and one secondary hospital as a contracted provider. In China today, usually people can go anywhere to get services. And to pool the government, I think for the public resources in China, we have two different kinds. One is from the government budget. The other is from the social health insurance programs. I think that they do things separated. There's no adequate coordination between the two departments. So I think we should pool the government fiscal revenues, spendings on healthcare with the public health insurance program funds. I think we should pool them together and use a certain percent of the pooled funds to pay the primary and the secondary hospitals with a prospective payment method. I think that in today's situation, the hospital revenues are positively related to the mobility of the population. The sicker the population, the higher the revenues of the providers. But in the future system, we should design so that the primary, secondary hospitals can financially benefit from the better health of their contracted residents, contracted groups. So how to do this? I think one way to do this is to use prospective payment method to the primary and the secondary hospitals, such as age-adjusted capitation, the global budget based on the number of contracted participants, and the payment for performances, for performance. I think we should explore new payment method, but in China, today's China, dominant payment method is fee for services. Okay? So we should encourage the people to go to the primary and secondary hospitals rather than all go to the tertiary hospitals. One way to do this is to make the primary and secondary hospitals cheaper. Okay? No deductibles, very low co-payment as compared to the tertiary hospitals. I think we can do this. And we should extend the preventive care to the non-traditional healthcare field, because many things are beyond the traditional healthcare, such as community lecturing on the healthy food, how to maintain health, something like this, and how to promote, physical exercises. This something I think the community health station or primary hospitals can be more actively engaged in these new fields of preventive interventions. And in fact, that there are many new practice at the community level already. We should highlight and duplicate the good practice of those successful experience. Okay, I think that the last slide. The tertiary hospitals can continue to be financed by social insurance programs. We have different social insurance programs, different contribution rates, different benefits. I think we cannot eliminate all the differences today. And we should enhance the competitiveness of the tertiary medical care, lower the entry barriers and encourage development of private, especially not-for-the-profit hospitals. Okay, and we should. I think very important thing is to eliminate price distortions. Thank you very much.